Have you just taken out a tooth? Listen to the following instructions. If you have just taken out a tooth or teeth, there are instructions that you're supposed to follow. So these instructions, I'm going to group them into immediate instructions, which is like from the period of removal to like 24 hours after, then intermediate from 24 hours to like a week after, and then the long-term instructions. So let's get right to it. For the immediate instructions, the first thing is, well, congratulations, your tooth has been taken out. So before you removed the tooth or teeth, obviously you were given an anesthesia to numb the place so that the tooth or teeth can be taken out. So after the removal and then bleeding has stopped and the dentist has discharged you, like you can go, your teeth has been successful, you were given some instructions. So maybe you have forgotten, but let's remind ourselves right now. First, the anesthesia is going to take about 1 to 2 or 3 hours to wear off. And once it wears off, you're going to feel pain. So it's preferable that you get ready with over-the-counter analgesics like paracetamol or ibuprofen, whatever your dentist prescribes for you. So get ready with that so that that pain would not get really bad. It is preferable that you go on a soft diet, at least for the next 24 hours, so you don't put any stress to that place. As much as possible within the next 24 hours, we want to prevent that place from bleeding at all. Avoid using straws. Straws kind of bring like a negative pressure into the mouth, and that can cause that place to start bleeding because it can dislodge the clot that has formed over the place where the tooth was taken out from, and we don't want that. If you are somebody who blows instrument, it is important that right now you lay low and just stay off any instrument blowing, so that, same reason as the straw, you don't end up dislodging the clot. And no smoking, no alcohol consumption. All these things will hurt that area and will impede the healing, and that's not what we want. Also, we can't overemphasize no stress. Like, don't stress yourself. After this extraction, just go home and rest. It's a surgical procedure, so it's practically like you've just had surgery. What do you do after a surgical procedure? You rest. So don't underestimate the fact that it's just a tooth that has been taken out. Go and rest. All right, so those are the immediate instructions. Now, within 24 hours to like 7 days, there are some things that you have to do to also help heal that place properly, because as much as possible you want that place to heal and not get infected. So therefore, after 24 hours, not immediately, after 24 hours, you start the warm saline mouthwash. So that means you put a level teaspoon of salt in a cup of water, and then you put it in your mouth and you gargle with it. Make sure you don't swash it around in your mouth with a lot of force, so you don't dislodge the clot that has formed. The essence of this warm saline, warm, not hot now, note, warm saline, is that it promotes healing of that place by increasing blood flow to the area, and it also soothes the place. So it soothes your mouth. It actually could relieve the pain a little bit. So it's really important that you do it as many times as possible in a day. Like, you can't overdo it, but minimum you should do is 8 times a day. So you might just time it along with your meal, before meal, after meal, before meal, after meal, before meal, after meal, before bed, or before you brush, or immediately you wake up in the morning. Just time it to like minimum of 8 times in a day. And you do that for the next 1 week, that's 7 days. So for the long-term instruction, it is important that you replace any tooth or teeth that was removed. This is to prevent drifting or shifting, like I mentioned in my previous video here. So make sure you check that out so you know the importance and the options that you have. So, having replaced the tooth, also ensure that you maintain good oral hygiene by brushing twice daily, doing your interdental cleaning, which involves flossing or using your interdental brushes, and by visiting your dentist twice in a year. So this is to prevent like you having to remove any other tooth or teeth. Routine extraction should be a simple procedure if all the instructions given are adhered to very well. We don't want infections. It is really terrible when you have a dental infection. So as much as possible, if you obey these instructions strictly, I promise you, you'll be fine and your healing will be smooth. So therefore, make sure you adhere to this instruction. If you've watched this video this far, thank you for watching this video this far. I hope you have liked, I hope you have subscribed. Until I see you in my next video, make sure you put a smile on somebody's face. Bye.